Good afternoon, I'm Deborah Smith. I'm going to be performing a physical exam on Mr. Jones. He has established himself as a new patient, and we have taken his height and weight and his vital signs. His blood pressure was 134/72. His heart rate was 82. His respirations were 14. He was afebrile at 98.4, and he was 170 pounds, and he's 5 foot 10 inches. And he's also given us a history, family history, and his own medical history. And I'm going to ask him a few questions first. Good afternoon, Mr. Jones. I'm Deborah Smith. I'm going to be doing your physical exam today.
Okay.
Welcome to our clinic. I understand that you're establishing new patient.
Yes.
All right, very good. I also see that your vital signs were taken.
Mm-hmm.
You had a preliminary smelling test, which was down the hallway, right? And it was 20/20 in your left eye and 20/30 in your right eye.
Right.
Okay, very good. And your blood pressure was good, and your heart rate was good. You didn't have any temperature. Also saw that you indicated that you take some medications. So can you tell me all the medications and all the vitamins that you take?
Okay. Just a little children's aspirin in the morning, and I don't remember what kind of vitamin it is. Like maybe Centrum or something like
Centrum, okay. Just a multivitamin
Yeah,
and aspirin, okay. And that's all you take?
Uh-huh.
Okay, very good. Also see in your history that you're a non-smoker,
Right.
and that you are a non-drinker also as well.
That's right.
Right? Also saw that you have a negative family history pretty much. Your parents are still alive. You have a mother who's 89 and a father who's 92.
Mm-hmm.
And do any of them have issues with diabetes, hypertension, cardiovascular disease, or cancer that you know of?
No.
Okay, so they get around pretty well.
Yeah, they do.
Okay, good. I also read that you're active and you do walking 3 times a week.
Mm-hmm.
Okay, great. Just continue that. Do you do monthly testicular exams?
Yes.
Okay, good. Those are good health promotion activities for him to follow. And if you could follow those from here on out, that's great. Also, you might want to do breast exams too, because for men, that is something sometimes that they miss
Right.
doing regular routine
Right.
exams.
Okay.
We're going to get started on your examination. We're going to do your head, your ears, your eyes, your nose, your throat. And I'm also going to check cranial nerves, and I'm going to listen to your lungs and your heart, and we're going to we're going to check your musculoskeletal system, and so it's going to be very thorough. So let's get started.
Okay.
Okay. All right. First thing I'm going to check is your scalp and your skull area.
Okay.
I'm checking your skull right now. Okay. I'm palpating for any bony prominence areas that are abnormal, that are maybe bulging. I don't feel any of those or depressions. Checking for bony prominences that are symmetrical, that do match side to side. There you go. I'm checking his hair. Your hair is well distributed. It has good hair patterning. And I'm checking your scalp for nevi. Nevi could be small, medium, large. They can be flesh color, light, dark brown. They look like little moles. I don't see any of that. Okay, I don't see any scaling. I don't see any issues with your scalp or your hair. As well, I'm looking at the symmetry of your eyebrows. They look healthy, well distributed with your eyes. There's no drainage. There are no lesions there. Your eyelashes are good. There's well distribution of your hair there. There's no drainage or issues that I see with your eyelids as well. I'm going to continue with your eye exam later, okay? Now I'm going to palpate your face, bony areas, and your facial bones. They're symmetrical all the way around, and I don't feel any areas, protrusions, or depressions. Okay, so that's intact as well. Okay, since we're into the face area, I'm going to do a few tests with your cranial nerves, okay?
Okay.
But the first one I'm going to just get right out of the box is cranial nerve 1, which is your olfactory.
Okay.
And it has everything to do with smell. Okay, and after that I'm going to do what's called cranial nerve 5 and 7. They're sort of out of order, but they go well with the way the exam goes, okay? So do you have trouble breathing?
No.
Okay, can you press one there and Breathe in for me. No problems?
No.
Okay, do the other one. Very good. Now close your eyes and press one there, one nostril. And do you smell this? Okay, what does it smell like?
Alcohol.
Good. Press the other nostril. And I'm going to do the same thing over here.
Mhm.
Then you smell that too.
Mhm.
Okay, quite strong.
Mhm.
All right, well that's intact then. Now I'm going to check cranial nerve 5 and cranial nerve 7, which is trigeminal and facial in that order. What I'm going to do is I'm going to test for sensory and motor together with the trigeminal cranial nerve. So if you could, first of all, open and close your jaw and do this back and forth with your jaw. Very good. Okay. So the pterygoid and masseter areas are intact and good, and that's part of your trigeminal area. I'm also going to do now the sensory portion of that. So if you could close your eyes, I want you to tell me what is sharp and what is dull, okay?
Can you do that one again? Sharp. Sharp. Dull. 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 Sharp.
Okay. Don't open your eyes.
Okay.
What is this?
Soft.
Soft? Okay. Very good. So cranial nerve 1 and cranial nerve 5 and cranial nerve 7 are all intact. You can open your eyes. We're going to now go to cranial nerve 2, which is your visual acuity. Okay, so I'm going to have you to put your glasses back on. I know that, I think that I read that they were bifocals, right?
Yes. Progressives.
Okay, and you had a good Snellen test, but we're going to do another one. This is a Rosenbaum test, and I'm going to have you to help me, okay? So if you
Okay.
can hold this card, you're going to cover one eye, and you're going to read the smallest line that you can. And then you're going to cover the other eye, and you're going to read the smallest line as you can. And it's going to be about 14 inches away. So you can hold that. Let me get a, there we go, because this is 14. Okay.
Four two eight 736.
Okay. Can you cover the other eye and do the same?
I can do the line above.
Okay, you can do the line above. Great.
937826.
Okay. All right. Very good. So your optic nerve has everything to do with visual acuity, and what we're going to do now is optic cranial nerve 3, 4, and 6. So if you could take your glasses off. So there you go. What we're going to do is, if you could face that way just a little bit. There you go. We're going to test your ocular motor, your trochlear, and your abducens. And those have to do with eye movement. And so what we're going to do first is I'm going to do a test of a confrontation. So I'm going to put my fingers around you, and then when you see the little bunny rabbit wiggles, then you tell me when you see them.
Okay. Okay. Okay.
Okay, very good. So that was a good test. So now I'm going to have you to follow with your eyes this, but not with your head. Okay, only with your eyes. Keep
Okay.
your head straight, and then follow this. It's going to be like an H pattern, and this is called the 6 cardinal signs. Okay.
Mhm.
Okay. So there was no nystagmus, no eye jerking of any kind that I saw. I'd like to also keep your eyes right here. We're going to do a little convergence test. That's good. And I would like for you to do the eye cover test too. If you could look straight at me and cover one eye. There you go. And uncover. Good. And do the same with the other eye. Cover. and uncovered. Very good. I did not see any jerking or nystagmus either with the eye cover test. Very good. So now I'm going to check your pupils. I'm going to shine a light from the side and on in. There you go. I'm checking for direct and consensual response. Very good. It goes from a 4 to about a 2.5. Direct and consensual response. Very good. I would also like for you to put your gaze in the direction of that spot on the wall. You see it? Okay.
Can I get this way a little bit?
Yeah.
Okay.
Sure.
Mhm.
Okay, and then I'm going to have you to look at this object right now. Okay? And now look at the distance again. And then look at this object again. Very good. So your accommodation is good. Your pupils react accordingly, and that's good. So what I'm going to do next is I'm going to do some more eye exam. I'm going to check the back of your eyes, and I'm going to, it's going to be a fundoscopic examination. I'm going to check the fundus part of your eye, and you know, there's issues that can come up with macular degeneration and eye diseases and with your vessels, so we're going to check that, okay? So I'm going to have you to look straight ahead over here. There you go. And while you're doing that, I'm going to center in on, there we go, on what's called the red reflex. And when I find it, which I do, I'm going to put my hand right here. That's okay. I'm going to come in closer. I'm going to come in closer. Keep looking. I'm going to put my hands right here. All right. And I visualize the vessels, and almost at the back center of those vessels, almost nasally, but sort of center, is your optic disc. The coloring is yellowish orange. I don't see opacities, pigmentation, or any issues. Your vessels look healthy. Okay?
Okay.
All right, I'm going to do the other eye. I'm changing hands and eyes myself, so keep looking ahead. I'm going to find your, there we go, red reflex. Once I find it, then I keep my attention on it, and I come on in. There we go. And I see your vessels, and I see your optic disc, orangey yellow. Your vessels are healthy. There's no opacities, no pigmentations, and that is a normal exam as well. Very good. I'm going to change out for the next section. Okay. Okay, the next thing is going to be cranial nerve 8. So with that, that's acoustic, and it's all about hearing. Okay?
Okay.
So let me know which ear you hear something in.
This one.
Okay?
This one.
Okay, very good. Next thing I'm going to do is I'm going to close one ear and I'm going to whisper something, and you're going to tell me what I whisper, okay?
I didn't hear green something. Green gate.
Green gate, good. I'm going to do the same thing.
Okay. Black door.
Good, good, very good. All right, the next hearing element I'm going to do is a Weber and Rhine test. So what this is going to do is test the vibratory conduction of sound. So I'm going to strike it and put it right here on your head, and you're going to tell me where the sound comes from, okay?
Mm-hmm.
All right. Where is the sound coming?
Can it be everywhere?
Yeah,
Okay.
it can be everywhere, and it is. Very good. All right, I'm going to strike this, and I'm going to put the end of this on your mastoid bone right here,
Okay.
and I'm going to ask for you to tell me when it stops, when the sound stops, okay?
Okay.
And then when it stops, I'm going to move it just a little bit in front of your ear, and you're going to tell me when that sound stops.
Okay.
Okay?
Mm-hmm.
All right. This is a test of sound conduction through bone and air.
Okay.
Okay?
Mm-hmm.
Okay, good.
Wow.
That's good because air is about double the amount of time it takes for the bone conduction. Okay? We're going to do the other ear, all right?
Okay. Okay.
Okay, good. Both ears are good. Then I'm going to also check your ears. Okay.
Mhm.
So I have an otoscope here, and I've got it on the largest speculum because we want to visualize the drum. Okay. And all the structures of the ear. I'm going to start with this one right here. Okay.
Okay.
If you could look that way for me, so we can.
Like that.
Yeah. Okay. I'm going to pull up and back on your ear. Make sure it's in good, and I'm steadying it against your face with my finger so we don't get poked. Okay, I see a cerumen, a little bit of wax there. Your canal is pink. It looks healthy. And your eardrum is healthy. It's pearly gray. I don't see any lesions. I don't see any drainage. I don't see any swelling or bulging of the drum or retractions. Everything looks healthy. Very good. Okay, if you could look that way, very good. You might look that way so that we can. Otherwise, I have glued the screen.
Am I good?
You're good.
Okay.
Up and back. I'm bracing against your head there with my fingers so you don't get stuck. Again, your ear canal is pink. It's healthy. There's no earwax in this one. No cerumen. Your eardrum is normal. It's pearly gray. It's not swollen. It doesn't have any retractions or no bulging, so that looks normal as well. Okay. I'm going to change this a little bit. And I also was looking at your, just so your lips didn't look like that your lips had any lesions or any problems with it too. Okay. What I'm going to do now is I'm going to change to a smaller piece. That's why I'm changing this right now, because here, this one fits better. I'm going to look up in your nose, and I'm going to check your nasal mucosa, and I'm going to check your turbinates and to see if you have a deviated septum. See what color everything is. Again, I'm going to brace my hand across your cheek, your fingers, so we don't stab you there. All right, it's pink. Turbinates are pink. There is no deviated septum. There are no polyps. There's no drainage. That's pretty good for this kind of weather. All right. Okay, I'm going to do this one.
Mm-hmm.
I'm going to put that in, and I'm going to look. Turbinates are pink. There's no drainage. There's no swelling. There's no polyps. That looks healthy as well. Very good. Okay, so now I'm going to move to checking your oral cavity.
Okay.
And in checking oral cavity, notice that you speak well, you don't have any hoarseness that I have noticed, or any issues with your speech at all. It's not raspy to me as far as when you talk.
Right.
So what's your street address?
403 Sycamore.
Okay, good. Just making sure
Okay.
with your speech. So that is cranial nerve 9, and cranial nerve 10 is the vagal nerve. So I'm going to check your oral your oral mucosa and your oral cavity, and I'm also going to check for gag reflex. Okay?
Okay.
I'm just telling you up front.
Yeah, thanks.
Okay, so open up and say ah. Okay. Your uvula is midline, your tonsils are there, your posterior and inferior pillars are intact and they're pink, your oral mucosa is pink, and I'm going to touch it right there, okay?
Mm-hmm.
Let's do it again. I want to do this side. Open up. Okay, very good. I apologize. So it's cranial nerve 9 and 10 do work, and I do apologize, but that's an important, your vagal nerve is important to check.
Yeah.
I would like to check your tongue. That's the hypoglossal cranial nerve. And if you could stick it out for me, open your mouth, stick it out. And can you move it to the right? To your right, very good. Move it to your left, very good. And let me check again, open. Okay. And put your tongue to the roof of your mouth. Okay. And again, push your tongue to the right. You know, I'm checking to the left.
Okay.
Or your right and your left. I'm checking for lesions because sometimes lesions to the floor of the mouth and the tongue could be problematic. So I'm going to open your mouth again. Your hard and soft palate are normal. Your gums are normal. Your pink, moist. Checking no gingivitis that I see. You have a missing tooth on the right lower side and a filling on the left lower side and left upper side. Okay? Other than that, that's a normal examination. Okay. All right. So, so we've gone over a lot of the cranial nerves. We've done the 1, the 2, the 3, the 4, the 5, the 6, the 7, and now we did the 9 and 10, and we've done the 11 with the hypoglossal. That was his tongue sticking out a while ago. And so now we're going to do, well, 12 was hypoglossal. We're going to do 11, which is accessory. Okay? And with the accessory muscles, I'm going to check your trapezius area. And I'm going to loosen this a little bit.
Okay.
Okay. I didn't see any deformities or anything there. I want you to shrug your shoulders. There you go. Up against my hand. Very good. All right. And as far as the other examination, as far as your other facial ones, I'm going to repeat one because I'm not sure if we did that or not.
Okay.
The facial, blowing your mouth.
Yeah.
We didn't do that.
No.
Okay. So close your eyes real tight. Okay. Good. Open your eyes. Look up and frown. Okay. Smile. Show your teeth. Blow. And then push up against my hand over here. That side towards your shoulder. There. Stick your tongue out there. Okay, good. Your tongue towards your cheek and push. Very good. Sometimes I do those together with the accessory cranial nerve also, simply because that's the movement of the head against my hands and then the shoulder movement and all too. So it seems like it's out of sync, but it fits
It works.
with that part of the assessment, right? So now we're going to go to your neck and throat area.
Okay.
Okay. I'm going to check for your glands. Okay, I'm going to palpate them.
Okay.
I don't see any swelling or anything on inspection. And now I'm going to lightly palpate. I'm going to start back here, actually right here, your periauriculars, with just the pads of my fingers, 3 fingers here, and postauriculars, and your tonsillar, submandibular, submental, and then I'm going to go straight to the anterior cervical chain. I'm going to go to the posterior cervical chain, and now I'm going to go to the clavicular, supraclavicular area. Okay, very good. I'm going to go to the occipital nodes. Believe it or not, you have some back there. Kind of lean over that way. Okay, and over this way, a little forward. Okay, very good.
Okay.
Now I'm going to check your trachea from midline
Okay.
at the sternal notch. That's my mark. And it is midline. It's not deviating. Okay, if you could look at the camera so we can see. There.
Do I need to turn?
Yeah, if you could turn just a little bit so we can do the rest of this.
Okay.
Very good. Okay. So I checked the trachea. It's midline. Now I'm going to check your thyroid gland. Okay?
Okay.
I'm just inspecting right now. I don't see any swelling. I don't see any issues there. You could swallow for me and let me feel first. Okay. All right. I'm going to get behind you and do a better exam, but I want you to have a sip of water here.
Okay.
I'm going to get right here behind you and take a sip.
Swallow it too.
Swallow it. Very good. Okay. So I have palpated your thyroid gland. It doesn't have any nodules. It doesn't have any lumps on it. It doesn't have any thrills that I could feel with my fingertips at all. It was symmetrical on each side. I'm going to check it for bruit also. Okay. Hold your breath. Very good. Hold your breath. Very good. All right. Now we're going to check your thorax and lungs, okay? So if you could turn around this way and face the wall over there and put your back this way so we can see. Okay, that's perfect. I might bring this in a little bit. There we go. Oh, that's perfect. Okay, so I'm going to do inspection first. I don't see anything asymmetrical at all. I've been watching you breathe. I don't see any retractions that you've done on inspiration or issues with expiration. I'm going to feel generally and feel for lumps, abnormalities, hard areas, swollen areas. I don't feel anything. Okay, now the next test I'm going to do is a vibratory test, and with this test I'm going to have you to say 99, and the ulnar parts of my hand are going to go across your posterior thorax, and I'm going to feel how the vibrations are, and that's the tactile femmetris. Okay, 99, ready?
99. 99.
Very good.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, very good. I feel that better when I use the ulnar section aspect of my hand for the fremitus. The next thing I'm going to do is I'm going to palpate some areas, and I'm going to first do this side, and then I'm going to move over and do that other side, okay, as well. Well, both sides, but for the purposes of the examination, I want to make sure that there's full view too. I'm going to start over here. I want to get below the scapula because it's not resonant over the scapula. There we go. It's resonant over the lung fields. Okay, very good. All right, with that in mind, I'm going to now do a two tests. I'm going to get on this side, and I'm going to put my thumbs around your 10th vertebra. Okay. And I want you to breathe in real deep. Very good. And relax. Very good. The next thing I'm going to do is what's called diaphragmatic excursion. So I'm going to palpate this area right here. I'm going to do this side so that it's visualized. And I'm going to start around here where I know it's resonant. And I want you to take a good deep breath. And when you let it out, exhale and then hold your breath on exhalation, okay? All right, take a good deep breath. Exhale, hold it, hold it, hold it. All right, you can breathe now. I'm going to put a little mark on your back. Okay? All right, now this time I want you to take a good deep breath, and when you breathe it in, on inspiration, I want you to hold it, okay? And ready? Okay. All right, very good. Okay, I've got those marks. You can breathe regular now.
Okay.
Okay, and I'm going to measure that. Very good. I got a 3.5 size, 3.5 centimeter diaphragmatic excursion, and that's good. Now I'm going to listen to your lungs. I'm going to do two things. I'm going to listen, and I would like for you to breathe in and out through your mouth, and I would like for your arms to remain like this if possible. Very good. Okay. I'm going to step around here so I can be in view. There we go. Okay, breathe deep in and out through your mouth. Good. 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 Okay, I'm going to come up to the side. I'm going to compare to that side. Very good. Okay, very good. So I've auscultated his lungs. They're clear bilaterally, normal vesicular sounds bilaterally, and now I'm going to have you to call out 99 when I listen to your lungs, okay? Because now I'm looking for bronchophony, which could be held present for consolidation, okay? Say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. And now I'd like for you to change it to E, E, okay?
Okay.
All right, ready?
E,
E.
E, 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 E.
Very good. So he has good lung sounds, and I didn't hear any bronchophony or egophony. The E sound would elicit a egophony sound if there was consolidation, and that sound would actually change from E to A, and it would sound very muffled. Very good. So now I would like for you to turn around, and I'm going to listen to your front side, your anterior chest, thorax. Okay. All right, if you could kind of turn in a little bit. Perfect. Okay. So I'm going to first inspect. Everything looks symmetrical. I don't see any retractions on breathing at all. And I'm going to now palpate a little bit here for any heaves or thrills or lumps or, okay. And so now I'm going to do a tactile fremitus on you as well, just like I did on the back. So you're going to say 99, and I'm going to feel how each side feels, okay? Say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Very good. So he has bilateral vibrations. There are no issues or problems with fremitus. And now I'm going to listen to your lungs, okay? Again, breathe in and out through your mouth if you can. Okay? If you can lift your arms for me, I would like to listen to your lateral lung feels. If you can lift your arm, there you go. Breathe in really deep. Very good. Okay. I want to do the rest of your respiratory assessment and your cardiac assessment. So if you could lay on the bed, please, that would be great. Okay. That's good. Alrighty. Cover up here. Right there. Okay, great. So what I'm going to do is I'm going to do a couple of things. I'm first going to move you in a little closer here so that we can visualize you a little bit better. Okay. All right. Very good. I think that's going to be a good, yeah, that's going to be really good. So I'm going to like move it just a little bit over so that I can be in the picture a little bit more. So I would like to lower this a little bit so that we can see what I'm getting ready to do. Just like we did with your respiratory with your back, I'm going to do the same thing. I'm going to put my thumbs like this, like a butterfly, and I'm going to put them near the bottom part of your ribs, and on inspiration I want you to breathe in. Breathe in real deep. Okay, and breathe out. Okay, so that's good expansion bilaterally, so that is not a problem. Okay, so now I'm going to go to your heart. Okay, one of the things that is important to consider with heart is your jugular venous pressure. So I'm going to step away from this field of view just to get my supplies. There we go. I'm going to move this back a little bit. There we go. Okay. All right. I'm going to check his jugular venous pressure. I'm going to look at the internal jugular, okay? And most of the time, it's the one that has two wave patterns and not one impulse. So if you can look that way, we are at a 30-degree head of the bed. It's up 30 degrees. That's going to be important to note. Sometimes with tangential lighting, you can see it, and I do see it. It's not to be mistaken with the single impulse of the external jugular, and I do see it right here. And so what I'm going to do is mark where it is, and then I'm going to mark at the menebrium right here, and I'm going to put a mark there. That's where that's going to go. And here's the point I see, and you really start that at the height of the point. Sometimes the head of the bed can go higher or lower depending on the condition of the patient, and it creates an angle. And so what we're going to do is measure that angle. There. That's better. And I get a 2. So his jugular venous pressure is at a 2. If it was greater than 3 or 3 to 4, then we might be worried about fluid, congestive heart failure, hypervolemia. If it's super low, it might be hypovolemia, but it does is a very good indicator for fluid status. Okay. And for your heart function as well. So that's good. I'm going to also do a heart assessment on you, and since the picture is a little bit closer, this will be easier to do also. So I'm going to first inspect. I'm looking at your carotid. So if you can look over that way, let me look. I don't see any heaves. And now I'm palpating only one at a time, only one carotid at a time. I don't feel any thrills or heaves. Okay, if you can look at me this way, there you go. Don't feel anything. Well, I do feel regular.
Thanks.
I don't feel any bruise or any thrills. And I have not noticed or seen any heaves at all. So, but yes, your pulses are regular, and the amplitude is regular, and the depth, and it's not bounding, and I don't see any problems with that. I'm going to also listen and auscultate with this time the bell of my stethoscope. So if you could look over there again. Any bruise? Okay, very good. And turn your neck this way. I'm going to listen over here too. Very good. Very good. Okay. All right. So that sounded good. Another thing while I'm checking with the heart is I'm also looking at other pulsations like the aortic area from the abdominal area too, and we'll be checking that in a little bit. So now I'm going to inspect the pericardium area, and I don't see anything abnormal. I don't see extra pulsations other than the maximal point of pulsation. And so what I'm going to do now is palpate near the left sternal border, the second intercostal space, left and right, and the third. That's good. And then all along the sternal border. And I'm checking for amplitude of ventricular contractions here. And there's nothing unusual, there's no heaves. It all is normal. Very good. I'm going to now check for the point of maximal impulse right here. Let's see. That's where I kind of thought I saw it. It's around the fifth intercostal space, and that's normal as well. Now I'm going to listen to your heart, okay? So I'm listening for an S1 and an S2. I'm listening areas of the aortic region, tricuspid, mitral, and in that we might listen for abnormal sounds, murmurs, issues with regurgitation or stenosis, and that would elicit specific sounds. Okay? So, listening to your aortic, pulmonate, tricuspid, mitral. But I want to do it even better. I would like for you to lay on your left side because I can hear differences in amplitude and disturbances in your, put your arm this way. Very good. I'm going to listen with the bell right here in the aortic area. I hear S1 and S2, and I don't hear any murmurs, turbulence, or issues. And then over a little bit more. Very good. Very good. Okay. All right. So your cardiac exam went well. I'm going to go ahead and move this cover right here. And I'm going to look at your abdomen. If you can put your hands to your side, your abdomen, it looks normal. I don't see any deviation. It looks symmetrical. I'm going to listen to all four quads with my stethoscope. It's going to be the diaphragm area there. Okay. 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 He's got good bowel sounds. You have good bowel sounds in all four quadrants of your abdomen. And while I'm listening, I'm going to change it back to the small one, the bell, and I'm going to listen for any bruise arterial bruits. And I don't hear any. I'm going to, where it branches off into your renal arteries, I don't hear any bruits either. There, very good. Okay, now I'm going to palpate your abdomen. It's going to be, let me move this so we can see. There we go. I don't feel any abnormal areas or firm areas. Okay, now I'm going to do a deeper palpation after I do percussion. I'm going to try and find your borders of your liver. Okay, I'm going to start up here. Okay, and as you can hear, when you palpate your abdomen, it sounds more like timpani. So there's a different sound there. Same thing for your spleen. I'm going to come down. There, very good. And now I'm going to try to see if I can feel your liver margins. And I don't feel a little bit, yeah, I do. I feel the margins there. Okay. Your spleen, I don't feel any of your margins in your spleen. Okay, very good. Now I'm going to press down in here to see if I can feel your kidney. Okay. All right. Okay, I did not feel your kidneys. Sometimes you can't palpate your kidneys, okay? So while we're here, I'm going to check some more pulses. Here's your brachial pulse. Okay, it's normal. And your radial pulse. And your ulnar. Okay. And so let me check your other arm. And I'm going to check them kind of together here. There you go. And this way. And then this way. Very good. Your pulses are good. All right. I'm going to check your femoral pulse now. Find that. Very good. It's up near your groin. Very good. I'm going to listen for bruise in your femoral. Very good. Okay, very good. Very good. So I'm going to move the screen a little further, and while I do that, what we're going to do is we're going to do a musculoskeletal exam. So if you could, while I'm doing that, go ahead and put your gown back on.
Okay.
But go ahead and stay laying down if you could.
Okay.
Okay?
Can I go ahead and tie it?
Yes, you can tie it. There we go. We just need a little distance here. I know a while ago we needed it closer for the visualization of your cardiac exam. Okay. Okay. Ready?
Almost.
Okay. I'm going to start with your arms up like this. Can you put both arms up? All right. And with a fist. And try to bring my hands in. There you go. Okay. And try to go against my hands. Very good. Grip my hands. Very good. All right. So you have good grips there. We're going to do more motion tests later. Okay. I'm coming down to your legs. I'm going to get my reflex hammer because we're going to use that in a moment. If you could try and lift up against my hand. Very good. And lift up against my hand. Very good. Okay. And I'm going to try to lift your leg up. Okay, very good. And try to lift your leg up. Very good. I'm moving down to I see your knees. Very good. I don't see any swelling. I don't see any bony areas. I don't see, you don't have any pain there or discolorations. Your feet, point your feet to the ceiling, both of them, and push back on my hands with your feet. Very good. Push forward with my, very good. All right. Checking also each one of your metatarsals. I'm flexing them too. Okay, very good. All right, I'm going to just pick your knee up like this, and I'm going to do a reflex. Let's do that again. Pull your, there. There. There you go. The other one, and pull your foot off the bed. That's okay, I got it. There, great. All right. If you can put this foot over here. Very good. Very good. And this foot over this way. Very good. Very good. Okay. All right. Let me check your brachial reflex. Very good. Okay. Very good. Okay, so your reflexes are good and intact. So what I'd like to do now is check your back. If you wanted to, if you could get out of bed on this side. There you go. Very good.
Like on the floor?
Yes. You can stand up. Okay. What I'm going to do with this exam is I'm going to ask that you turn around and touch your toes, if you can. There you go. I'm going to check your vertebra. Okay. And stand back up. I don't see any curvatures of your spine. I don't see any abnormalities. I don't see any issues that are problematic. Now what I would like for you to do is walk regular to the end of that wall. And then turn around. And then walk back on your heels. Walk back on your heels. Good. And then turn around and walk on your toes. And I'll try to turn this down so we can see ya. Okay, good. Now you can turn back around. All right, very good. Okay, so we're going to do some other exercises. So I'm going to have you to take this arm and throw it across your shoulder as good as you can. Very good. Let's do the other one. Very good. That's good. Good for shoulder rotation. So with this arm, can you go behind you and touch your scapula? Very good. And the other one. And let's turn around so we can see. Very good. Okay, turn back around. Okay, so with me, watch my head and copy me. Look that way. And that way. Okay, rotate your neck. Lean forward. Try to lean all the way back, as far back as you can. Good, 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 good. Awesome. So with your arms, again, let me pull down on the strength. Very good. Your hands, point them to the floor.
Like that?
Yes.
Okay.
Okay, then point them to the ceiling. Good. Straight. Spread your fingers out. Together. Keep your wrists straight. Only your hands in. Only your hands in. Very good. And straight. Hands out. Okay, so that's adduction and abduction. Abduction is out. Adduction is in. Okay? Very good. Very good. So I think that concludes the exam. Mr. Jones, I would like for you to continue all the good work that you're doing. And you have good genetics with your parents, and you have good healthy lifestyle, and keep that up. Give us a call. If you don't have any complaints or issues, then please come back for your annual examination. Okay?
Absolutely.
Thank you very much.
Thank you.